Bisson, who is an agriculturist of long-standing and a Jerseyman of long-standing, and one of the leaders of the agricultural section who led the promotion of our potato in the UK. Graham has been a steadfast friend for many years and is going to give us a very personal tale this evening. Graham.
Good evening, everybody. The example I'm going to share with you is not only up to date, but it is also a personal one. In October, November 2019, the promoters of the Jersey Care Model went on a parish hall roadshow where they publicly stated healthcare that was free then would be free in the future. We were also assured that the quality of services would be every bit as good, if not better. On the 12th of May this year, the Health Minister, Deputy Richard Renouf, in an email stated, services that are free at the point of access will continue to be free, regardless of where these services are delivered. On the 18th of June this year, Ms. Caroline Landon, the Director General for Health, during a health scrutiny meeting said, what was previously free in the past would be free in the future. And if anybody had a problem, they should send her their details. I have done that, and all that's happened has been bounced around from one civil servant to the other. With these prominent people all reiterating the same message, one would have thought that this was the truth. But in fact, this is not the truth. If it is not the truth, then it must be a lie. Some of our states members and civil servants seem to have great difficulty in being honest. In June last year, the Health Service closed Samurai Ward in Overdale. I think it's fair to say that Samurai Ward was a world-class head injury and stroke rehabilitation centre, but it was closed under the guise of the Health Service requiring it for COVID recovery purposes. In its place, we now have 2 small units with 6 beds for men and 6 beds for women on the Clemmer Ward at the General Hospital. The equipment in this facility and the service provided is a shadow of its former self. I know this from first-class experience. Before the closure of Samurai, there was no limit on people staying there and no cost to the patient involved. Samurai had 28 ensuite rooms, but the hospital only has 12 beds in 2 small wards. Having received an inferior level of rehabilitation, a patient must now leave hospital after a maximum of 13 weeks and can only return home if the family can provide a satisfactory care package that is acceptable to the authorities. In circumstances or personal finance don't allow for this, the states will put them into a nursing home chosen by the states. Returning to our personal experience. On the 12th of December last year, my wife of 55 years had a serious stroke and spent the following 13 weeks in this replacement facility on Clemmer Ward, where her care was nothing like that which she would have received had she been in Samurai. She is now back home. She has now been back home for 16 weeks and is unable to stand or to walk, but she is here tonight. With some difficulty, we were able to put a care package together, which was acceptable to the authorities. Making alterations to our home and purchasing a second-hand disability vehicle cost us £46,000. However, by far the greatest difficulty was finding carers. Our allocated social worker from Social Security contacted all of the 22 care agencies with no success. The following week I contacted the same agencies and fortunately found 3 who were able to help. The agency we chose, which we are very pleased with, provide 2 carers who come in at 8 a.m. and 8 p.m. for an hour each time. That leaves me as principal carer for 22 hours a day. That is a huge commitment. Anybody who knows my wife will know that she is a lady who never complains about anything. Is there anybody else in the room who doesn't complain? Any lady doesn't complain about anything else? No, you all complain. But after 3 weeks at home and with no physiotherapy provided, she said to me, "I really feel as if I have been neglected, and I am worse now than the day I left hospital." Without considerable physiotherapy and occupational therapy, progress is not possible. After several weeks, I contacted the hospital and they offered my wife 1 hour per week of physiotherapy up at Overdale. When asked how long that would last, the answer was, "We have no idea." After 6 weeks of 1 hour's treatment per week, the following 3 weeks were cancelled, one after the other, at short notice because there was no physiotherapist available. Because of the situation, we have had to employ a private physiotherapist for 2 one-hour sessions per week. In addition, we have made private arrangements for my wife to have 2 half-hour sessions in the aqua pool at the Jersey Cheshire home. Our homemade care package, is now costing us £65,000 a year. That's £5,400 a month, or £1,250 per week. On the 1st of June this year, the General Hospital employed 76 physiotherapists and 30 occupational therapists. My wife is a Category 4 patient, and at the moment, the current long-term care payment for Category 4 patients is £1,094 per week, or £56,888 per year. This means that after we have paid the first £58,230 to reach what the long-term care call their threshold, the shortfall between what Category 4 patients receive and what our care package is costing us at the moment will be £19,000 per annum. To add insult to injury, the cost of private physiotherapy, the aqua pool at Jersey Cheshire home, and the cost of home improvements are not considered to be care costs by the authorities, and therefore do not go towards the long-term care threshold that needs to be met before any long-term payments are made. As far as we're concerned, every part of the care package that we have put in place is very much a care cost, as each one is absolutely essential to her well-being and recovery. In summary, by following the lead of a team of senior civil servants who care little and understand even less about our island, our states members have willfully voted to deny us access to previously provided world-class care, funded and delivered by the state, without so much as a proper debate. In its place, they have managed to inflict us with the Jersey care model, a do what you can at home with whatever funds you have available scenario, in which the state has simply turned its back on its citizens. Over the last 4 years, our group has spent an incredible amount of time researching and studying all the expensive reports that have been produced. We are passionate about this island and our future healthcare in particular, but also very concerned about the way we are being governed. It has become abundantly clear that our current Council of Ministers is weak and inept. They lack any sign of original thought and have relinquished all authority, handing it to the unelected Director Generals, carefully selected by the disruptive and squandering former CEO, Charlie Parker. This is crippling our island. Our island is being mismanaged and systematically bankrupted. Everyone knows it, and it would seem that the majority of islanders have reached a state of despair. Surely something can be done. Enough is enough. Nothing will improve until the current Council of Ministers is removed. For those of you who chose to be here tonight instead of watching 22 people chasing a ball, thank you for coming.